Hi, I'm Dr. Huang. I'm a physical therapist here at Rehab and Revive. In conjunction with physical therapy, I also specialize in lymphatic drainage and pelvic rehabilitation. The pelvic floor is a commonly used phrase in pelvic physical therapy. It is a group of muscles that close off the pelvic outlet, acting as a hamlet-like support of the pelvis. The pelvic floor supports the abdominal organs and plays a key role in urination, bowel movement, sexual function, and postural support. Now I'm going to show you steps to find your pelvic floor muscles and do a Kegel exercise. So we're going to start laying down first. This is the easiest position. You're not fighting against gravity. Usually I like to keep your knees bent. If you want pillows, you can actually put pillows and then so you're mostly relaxed in laying down position. So we're going to first start with just regular breathing, the diaphragmatic breathing. You're going to breathe in through your belly as you breathe in, and then as you breathe out, your belly goes down. So we're just going to do a few breaths like so. Breathing in and breathing out. Now I want you to pay attention to your pelvic floor, which is from your pubic bone to your tailbone between your sit bones, okay? So don't do anything to the pelvic floor area yet, but just breathe in and breathe out and feel the movements as you're breathing in and breathing out. Normally, when you breathe in, your pelvic floor will get pushed away. When you breathe out, it will kind of pull in a little bit. Okay, it's kind of like a balloon. As you breathe in, it opens. As you breathe out, it kind of retracts. Make sure you can feel that. It's a very subtle movement, but make sure you're able to feel that. This is going to help you find your pelvic floor muscle when you're doing the Kegel exercise. Now as you're ready, we're going to start with your Kegel exercise first. I want you to kind of picture you're pulling a zipper from your tailbone all the way to your lower abdomen, okay? So we're going to do a little bit at a time. So you're going to gently pull that zipper from your tailbone toward your anus, to your vaginal openings, urethra, and then it's come to your lower abdomen. It's going to be like a squeezing and lifting motion. Once you hold it all the way up there, you're going to just hold the contraction. You're going to hold it for 10 seconds. But make sure you're not holding your breath. As you're holding the contraction, make sure you still breathe. And when you relax, we're going to relax a little bit at a time. Don't just let go of everything, okay? We're going to control letting it go, like you're slowly opening up the zipper. I'm going to give it a try one more time. I will walk you through it. See, zipping it up from your tailbone, pass through your anus, your vaginal openings, urethra, into your lower abdomen. Hold it for 10 seconds, but continue to breathe. Do not hold your breath. And then now we're going to slowly relax, opening up the zipper a little bit at a time, until you feel like your tailbone is opening up. If you're noticing you're clenching your buttock when you're doing this exercise, you're not doing it correctly. If you're squeezing your knees, try to get your pelvic floor working, it's not correct, okay? It's just solely at your pelvic floor area. Most likely nobody would know that you're doing an exercise.
Me doing Kegels at the dinner table.
Nobody's gonna know.
They're gonna know. How would they know?
Now we're going to go to the next Kegel exercise, which are quick flicks. Same idea. You're just going to do it quickly, squeezing, and then you're going to let it go. It's like a quick flick, and then let it go. Quick flick, and let it go. But I want you to make sure every flicking, you want to relax all the way down before you do the next flick. If you just keep doing flicking without relaxing it, sometimes your muscle will just become tight and then you're just going to have a hard time letting it go. So we want to get in a good habit of every time you flick, as you let go, make sure you're fully relaxed. Then you flick and fully relax. So usually when you train your pelvic floor muscle, we're going to start with 10-second hold, 10 times of the holding. And then we're going to do 10 quick flicks, 3 times a day. Once you feel pretty comfortable in the laying down position, then we can move on to the sitting position. Sitting is going to be a little bit harder because you're fighting against gravity, but same idea. So when you sit up, make sure your feet is touching the floor. You're not like sitting slouch position or your leg is way up here. Then, kind of get a sense of where your pelvic floor is. Usually right now when it's relaxed, you will feel like it's kind of almost touching the surface that you're sitting. Now we're going to do the long holding. Same idea. You're going to kind of gently squeeze and lifting until you feel that lower abdomen tightening it up. Hold it for 10 seconds. Do not hold your breath. And when you're sitting, the relaxing is very, very important to really control it. This is we call eccentric training. It actually strengthens the muscle even more. So you're going to slowly relax and letting it go. Until you feel that your muscle is touching the surface that you're sitting on, just like when you first started. So this is the same idea. You have to think about when you're doing this exercise. If you're sitting in front of a dining table, nobody should know that you're doing this exercise. Right? They shouldn't see you doing this. They shouldn't see you doing holding breath, that you're trying to do the Kegel exercises. And you can progress to standing as well. I'm not going to show you that. You can just kind of practice on the sitting first until you feel like you're really strong in this position before you go to the standing. This is a very important part. I do not want you to practice your Kegel exercise when you're urinating. It can actually interrupt your regular urinating cycle and cause your brain to think that you actually don't want to urinate at this time. And it can cause further problems. So make sure you just find time to practice the Kegel exercise rather than sitting on the toilet and try to stop your urine and to strengthen your pelvic floor muscle. You may progress your training in sitting and standing once you gain proper awareness of performing the exercise. Hopefully you have given this a try and felt a change. Check with your healthcare professional to make sure this is right for you. I'm Dr. Huang, and thank you for tuning in.